Okay, so you open up a health talk with a tagline. How's this one? Welcome to True Health Tuesdays, and the truth will set you free. Was that too dramatic? Hip dysfunction, okay, because we're not just going to talk about pain, we're going to talk about actual dysfunction. And I was inspired to do this because where is the pain coming from? What's wrong with our species? Why is our species kind of breaking down? We're going to go over the commonly missed causes, similar to the shoulder, where we're going to look at the neurogenic or neurologic, any nerve factors, because when you compromise the nerve supply to an area, you compromise the function of that. And vascular, you're going to find out that the blood flow or the health of the blood is vital for the health of the hip. And these are things that are not talked about. And the mechanical, what causes a hip to wear out? Is it more than the mechanical distortion? You're going to find out that the standard view is completely ignorant. Now, let's look at what a normal hip looks like and what the structure of it is. When you look at it, we've got two dysfunctional hips on the bottom, and we've got a normal graphic representation in the middle on the bottom area. And we got a beautiful normal hip on the top. What that round part is the head of the femur. It goes into this socket called an acetabulum. But what you can't see on the x-ray are the structures around it. You've got cartilage, you've got ligaments, you've got a synovial membrane going around it, and that synovial membrane holds synovial fluid, which is a superfiltrate of blood. So that's not really a space there. That space is filled with cartilage, ligaments, and fluid. Now the fluid of that synovial membrane is a constant filtrate. In fact, every time you take a step, that bone pulls out of the socket just enough to create a negative pressure in order to regenerate synovial fluid. And so when you stand on it, you make a compressive force to almost drain the joint. It's not completely draining it, but that negative positive pressure is what occurs when you take a step. Now, how long are hips supposed to last? A lifetime? Really? You mean it's like as long as you're alive, a hip is supposed to last? Keep this in mind, because I'm going to bring up some completely ignorant people that think that, well, it wears out because you use it too much. Okay, and that's not true. It's just not true. So I want you to pay attention to the damage of it. See, when you're looking at a hip that's destroyed, the round bone is starting to break down. So that means either the blood supply, nerve supply, or biomechanics, those three aspects are altered. It does not wear down from use, okay? It doesn't wear down from wear and tear. And that's the common misconception, because the way this is designed, if you use it, it lasts longer. It's better for it. And in fact, when you look at, have you ever seen anyone crack their knuckles? British Medical Journal found out that habitual knuckle cracklers actually had a remarkable lack of arthritis. It turns out that if you utilize a joint, you have healthier joints. So now let's look at what causes it. Because the whole thing is, this is living structure. Now the mechanical joints that they put in are a miracle. The challenge is that they only last about 10 to 15 years. They came up with a really cool joint that's been recalled now, a metal-on-metal joint. And it turns out that that metal-on-metal joint is bad because it does tend to leave small metal flakes in the body, increasing heart disease, cancer risks, and other damage, because you're just making little tiny metal flakes. So it turns out that metal inside the blood isn't good. This was the inspiration for the talk. Okay, a really good friend. I've known her for over 30 years. Healthy. I mean, this gal, spin class, central, dynamic. I mean, amazing. She lived in Connecticut, and this was her first x-ray on the top left. And you can see the spine comes up and deviates off to the side. Well, now, when you look at nerve supply to the hip joint comes out of the second lumbar. That second lumbar nerve root comes here. And you can see the rib cage up there, right where the spine takes the worst lateral deviation is the second lumbar nerve. And just like anything, if you compromise the blood supply, the joint's not going to be healthy. You compromise the nerve supply, the joint's not going to be healthy. And what you'll see typically is over and over and over again, one side is beautiful, the other side sucks. And again, we got this mentality of, well, it's just overuse. How could you use one side and not the other? Unless you're some type of, plant operator that you're just working a cleaning machine or something. But that's not the case. And what you're looking at here, and I blew up the right hip and the left hip, and you can see the right hip is perfect. The left hip, it has a perfect head shape to it. It's just a little bit compressed. And I told her, I said, no problem. We can fix this, guaranteed. There's no distortion of the bone. Even when we have bony distortion, we're pretty successful at regenerating the cartilage, regenerating the synovial fluid. You'll be fine. We had a before and after x-ray, because remember, she's coming out from back east, and she got some really good results, started to feel a little bit better, but then she goes back, and a friend of hers said, that chiropractic thing's kind of good, but why don't you just go out there and fix it? Just get the operation done, get a brand new hip, you'll be just as good as new. Okay, yeah. As good as new when you're like 59 and they only last about 10 to 15 years. So when you're 75, you got to have another operation. And then when you're 85, you got to have another operation. Well, she couldn't find a corrective chiropractor back east. So she had it done, a fake hip. And the most frustrating aspect of this, not that she didn't listen, but that she was starting to get results, but chose to do a therapy that I know is toxic and dangerous. So I thought, let's look at hip injuries, or let's look at it. Now, this is a brilliant article at a Health Day News, February 12, 2015. It's interesting. The number of hip replacements performed in the United States has increased substantially, and the procedure has become more common in younger people. Why? Why? Why are hips wearing out now? And when I say hips, I want you to think about this picture here, where there are one perfect hip and one hip that's been replaced. What was the problem with that one hip? Okay, it was compromised blood supply and nerve supply. That's what it is. That's what's totally missed. And also, we're going to go into the different therapies that are prescribed in today's society to cover up the discomforts of those. Well, between 2000, this was a good article studying hip replacements from 2000 to 2010, and that 10-year it increased 224%. Now, I want you to ask yourself the question, what's going on? Are people wearing out faster, or is technology much, much better to where we can give them all brand new hips? Yeah, okay, well, it turns out, and when you read this and you understand that hip joints, the more you utilize them, as long as you have healthy blood supply and healthy nerve supply, the hip remains healthy for forever. They don't wear out. Most hip replacements in middle-aged patients are due to degenerative arthritis caused by wear and tear. So high numbers of active people translate into more arthritis. Thus, the number of patients who are appropriate candidates for hip replacements at a younger age grows. Oh my gosh, what a sick species. Don't use your hips and they won't wear out. So you shouldn't run after the antelope, okay, and forget being a hunter-gatherer. You'll have to bend over and pick up the, make sure your dog doesn't run. His hips will wear out. Make sure, do you understand? This is psychotic. American College of Rheumatology did another study from 1997 to 2004. It turns out in that 7-year span, hip replacements increased 37%. And they're saying back then in 2004, there's going to be about 600,000 hip replacements every year. The problem is the revisions. And this means that it doesn't work. And you're looking between 10 and 12% of the hip replacements that they put in, they got to take out and redo. No, that's not good. It turns out that if you've had this hip replacement and they take it out and put it back in, the potentiality morbid with 2 or 3-fold higher risk of mortality and major complications more than the primary total hip replacement. Turns out the revision is very dangerous to your body, your life, and your health. So to get a hip replacement is not a minor operation, particularly if you're planning on living beyond 10 to 15 years. This is a major deal. And it's interesting, the number of revision and primary total hip replacement surgeries performed in the U.S. increased by 50% from 93 to 2004. The growing burden of revision of total hip replacements over the next decade with attendant complications and disability and cost. They're looking at this and they're saying, well, yeah, if we do more hips, we're going to have more challenges with it. And remember, how long do they last? See, this isn't, you just had your hip replaced and 15 years from now, the darn thing's worn out, we got to replace it again. This is happening within the first couple of years that the hip didn't take. Okay, there was a problem with the age, there's a problem with a rejection factor because you do have a foreign object in there. And now this article, when it was written, there was no national registry. What that means is, imagine if we're doing an operation and we don't have any data on if all the operations that are being done are successful or not. Or what data on the patients that we give that operation to, if they're going to be successful. So let's say if they're overweight, out of shape, taking cholesterol drugs and blood pressure drugs, is that healthy blood supply? No. Do they have a higher hip rejection? We don't know. Don't know. Unknown. So we look at this article. U.S. population-based rates of revision have not been determined. There are no U.S. population-based studies of risk factors for total hip replacement failure leading to revision. There is no national total joint registry in the U.S., and therefore no reliable estimates of the annual and cumulative rates. We don't know, but we do know that the surgery is very profitable. These observations highlight the urgent need for population-based studies to define risk of failure leading to revision of total hip replacement and identify the risk factors. Well, luckily they started one. Now it's not a total national registry. It started back in 2013. There's 612 hospitals currently registered in this out of the thousands of hospitals in America, and they're starting to collect the data. So it is starting now, but it's, this is like a couple of years old, and their idea is solid. Except this is way downstream. No one's looking at why hips are being deteriorated. No one's, okay, good. We understand that hips, the fake hips wear out. We understand that about 10 to 12% of them have to be replaced because of some unknown factors, and we can't identify those factors, and to tell you that you're at risk of hip revision, which is going to be really nasty. I want you to own the structure of the hip. It has to do with mechanics, blood supply, and nerve supply. That's it. If you have toxic blood, you're not going to be able to filter it through that synovial membrane. And that synovial production, this is why people with diabetes who have toxic blood end up with joint problems. This is why gout, the toxic blood, ends up with crystals inside of the joint that destroy the joint. This structure is designed to last a lifetime. The degenerative arthritis doesn't happen because of wear and tear. This is why consistently you're going to see one hip wearing out and the other hip fine. So we have to look a little bit deeper at the compromised blood supply and nerve supply. Does that make sense? Okay, unless there's some kind of weird genetic defect And you don't pass on defective genes. That's counterintuitive to how biologics work. Okay, we pass on the stuff that makes our species successful, not that deteriorates it. So what kind of things would deteriorate a hip? What kind of things are commonly prescribed? Non-steroidal anti-inflammatories, okay, Tylenol and Tylenol. Non-steroidal anti-inflammatories destroy the building block of cartilage. What's the first thing you're going to get if you have hip pain? Non-steroidal anti-inflammatories, ibuprofen, Motrin, Aleve, all of these things. We know that they destroy joint cartilage. Now let's say you still have hip pain, okay, and you're taking this. How many people take this for year in, year out? Why? Because it feels good. No one's saying, you know, hey, this non-steroidal will make you feel real comfortable, kind of, a little bit. It only works occasionally, but it does. It's going to guarantee that you're going to have more hip destruction or joint destruction if you use it longer. Is that ever given out? Is that information ever given out? I'm not saying that that you should suffer. Okay, suffering doesn't purify the soul. I mean, that doesn't make sense. Okay, what you want to do is find out why it hurts. Doesn't that make more sense? Respect the body and the body's processes. This hip, if it's deteriorating, does it make sense that it's not getting healthy synovial fluid? So that synovial fluid is going to give nutrients to the cartilage. It's going to give nutrients to the structures in there. So when you look at a degenerated hip, doesn't that look desiccated up? Doesn't it look like dried? That it's not getting the nutrients, that it doesn't have the healthy cell transfer? Because that's what's actually happening. The body has to lay down new tissue, but it doesn't have the appropriate nutrients or stimuli. What are some of the other effects of the non-steroidal anti-inflammatories? Let's just pick Tylenol, the most commonly prescribed pain reliever in the world. Okay, psychiatric effects, asthma risk, toxic epidermal necrosis, blood cancer. Yeah, but you have temporary relief of joint pain. Of course, it does destroy the joints. Journal of Hepatology. Its benefits are said by the Food and Drug Administration to outweigh its risk. It still must be asked, is this amount of injury and death really acceptable for an over-the-counter pain reliever? I don't want you hurt. I don't want you hurting. But I do want you to respect that the body gives you some symptoms. You know, if you got a red light flashing on the dashboard, you don't say, Jesus, take care of that red light, it bothers me. You look at why the red light's flashing. So let's look at the factors that lead to hip degeneration. And these are also factors that if you correct now, even if the hip is deteriorating, you can help the person. Sacroiliac joint dysfunction. Now, we had a chiropractor observing here today from Connecticut, and this shows kind of like the nasty instructor I was. I said, name the muscle that crosses the posterior aspect of the SI joint. You know the correct answer? There isn't one. I know. It's kind of mean, okay? Yeah, I think I was adjusting you when I asked him. And now this is a posterior aspect, or the back half of looking at all the muscles there. What I want you to do is look at the structures in there. So that the sacroiliac joint is a perfect joint. It never wears out. But if you've had long-term low back issues or a sedentary lifestyle, you're going to be spreading open and irritating that joint. Now, here's the challenge. Inside of that joint is the autonomic nervous system, automatic nervous system. And this is in two parts. One part is the cranial sacral. So if you have pelvic dysfunction, the cranial sacral or the parasympathetic nervous system is going to be altered. 100% of the time when somebody comes in here with hip joint, hip pain, I say, take off your shoes. Let me take a look at your feet. You know what I'll see? If I see flattening of the feet, bunion formation, a lateral deviation of the toe, man, those nerves that supply the feet are compromised. And think of this. If the feet are compromised, knowing that the foot is a coiled spring and it's designed to cushion your gait, if you have a flattening of the feet, is that going to change your gait? Is that going to change how that dynamic of the hip, the biomechanics of the hip, is that going to change that? Yes or yes? Absolutely. So you're not going to have hip degeneration unless you have bunion formation. You're not going to have bunion formation if you have healthy nerve supply to the foot. So that flattening of the feet, the bunion formation, all that indicates that the nerves are compromised to that. And then what I'll ask, if I see that type of deviation in the foot, now remember, we're talking about the hip, but it all is interconnected. It's like doing detective work. So when you look at that flattening of the feet, beginning lateral deviation of the foot, maybe bunion formation, what are you going to ask? Since it's connected to the parasympathetic nervous system, how many bowel movements a day do you have? Typically, 1 if I'm lucky. You're supposed to have 3 a day. So that means that the parasympathetic is compromised. That means the rest, digest, and repair. That's slow gastric motility. Rest, digest, and repair. The rest is also going to be messed up. How do you sleep at night? You know what the answer is going to be typical? I'm exhausted all the time. I fall asleep right away, but I never wake up. I'm exhausted. I'm tired. I'm fatigued all the time. And they're coming in, what are they coming in for? Hip pain. So nobody, that's a red flashing light. We got to fix everything. When you look at this, if that sacrum is dysfunctional, you're going to have an alteration of the parasympathetic nervous system. Now, this nervous system has a balance. That means that if the parasympathetic is down, what's up? The sympathetic. If the sympathetic is down, the parasympathetic's up. We already know the pelvis is compromised. Why is it compromised? Sedentary lifestyle, direct trauma. How many times have you fallen on your butt skiing? How many times have you been injured horseback riding? Does anyone like riding horses in here? Okay, okay, good. So you and me are together. Yeah, I don't like them either. Okay, so you know, I got to ride a Clydesdale. Okay, you know, the legs are out like that, but it will damage the pelvis, along with, like, you know, motorcycle riding, sea-doo riding. All of those things can damage that. So if the parasympathetic is altered, the sympathetics are going to be firing. So how many people have been misdiagnosed with thyroid issues, with stress issues, with attention deficit disorder, all of these things, and it boils down to a sacral problem or sacrum issue. This nervous system, it controls and coordinates every function of the body. If you damage an area that houses half of the automatic nervous system, it's going to alter the physiology or how the body reproduces it. However, you can see that the nerves come out on a segmental level. The ones that supply the hip are the second lumbar nerve. It's hard to tell from this picture, but you've got this immobile rib cage, okay, that's designed for protection. It's going to protect the lungs and heart on top of a very mobile lumbar. This is why you can move like this. At the junction of that immobile rib cage area and the mobile lumbar is L1, L2, and L3. L2 supplies the hip. So this area is prone to torsion injuries. This area is prone to have some damage. That friend of mine had a major osteophyte, which is a bone spur, which indicates that her damage at that L2 level was there for at least 10 years. Piriformis. This is one of the most frustrating conditions that a person can have. Has anyone gone out to a good steak dinner and you go to get the steak and the steak leaps off the table, runs around the floor, runs? No, never happened? Okay, the reason is muscles don't react on their own. For some insane reason, they teach this stuff in schools. Man, it's a piriformis spasm. You know, we just got to work that sucker out. You know, I had one guy, 5 Botox injections of the piriformis. Now, this is a muscle that I know, I was going out too. It's the only muscle that crosses the sacroiliac joint, but it crosses on the front portion of it. So here's a clue to every physical therapist, every chiropractor, every doctor out there. If you have a spasm piriformis, it's spasming out for a reason. It's not a bad muscle. We don't need to discipline it with some Botox. Okay, we got to find out that it's increasing it's increasing in tone because of an unstable sacroiliac joint. It only spasms out for a reason. To relax a muscle without understanding why the reason it's spasming out is insane. It's not appreciating that the body is intelligent. And if we keep discounting the intelligence of the body and we do stupid things to mask that, we're going to keep doing negative things to the body. It's kind of like, here's a non-steroidal anti-inflammatory for your hip pain. 5 years goes by, ooh, bummer, you got degeneration. Does that sound familiar? Okay. So the piriformis will be increased in tone if there's unstable pelvis. And the pelvic muscles, here's again, if you see someone with an unstable pelvis, is that going to alter the mechanics of the hip? Absolutely. You're going to see this in the mall. Normal people, when they walk correctly. There's a smooth fluidity of it. In the mall, if you see someone walking like this, okay, that's flattening of the feet. It's going to be destroyed hips. You're altering the mechanics. Okay, and what that's going to do is you're going to have pelvic insufficiency. The pelvis floor, okay, that houses, it's got the prostate if you're a guy, you've got anus, rectum, vaginal areas, all of that, and those organs are pushing down. If that pelvic floor is damaged or unstable, you're talking that those structures are going to be unstable. So bowel and bladder insufficiencies. You see somebody with flat feet, that means altered mechanics to the hip and the pelvis. Flattening of the feet, that's going to be knee issues, hip issues. All of this stuff is connected. Okay, it's not separate. And it all starts with perhaps my hip hurts. Okay, exactly. And that altered gait and everything else. And then what do you see? Bowel and bladder insufficiencies, leakage. I see the commercials all the time. Okay, try this new diaper. It's amazing. It's really thin. How about looking at the problem? I know, you see the commercials too. It's like, what? Are you guys crazy? Find the problem. Problems with the pelvis. We're looking not only sciatic nerve, pain when you're sitting, bladder control, sexual dysfunction, leg pain, walking pain, foot pain, knee pain. I mean, this is a big deal. If you're altering that parasympathetic nervous system, you're talking incorrect digestion, poor bowel movements, diverticulitis, all of this stuff. And it's all missed most of the time. And forget, one of the things is Kegel exercises. This will help the pelvic floor. The challenge with this is, what if you have compromised nerve supply to the pelvis floor? It's kind of like having a tourniquet on and then saying, okay, go out and do some working. Okay, it doesn't make any sense at all. So you've got to restore the nerve supply to the pelvic floor and then do Kegels. And a Kegel exercise, I know every guy in here has done it, okay, because, well, when you're in the snow, okay, you're a teenager, you're writing your name, okay, yeah. I mean, luckily John is easy, you don't need to stop. But if you have a T or an I, okay, you have to stop the urine flow. The muscles that you use to stop the urine flow, so you can switch to the next word, okay, is the pelvic floor muscles, the Kegel muscles. Okay, so what you do is you tighten up those muscles, okay, for about 5 to 10 seconds, do it about 5 to 10 times, and that's going to help strengthen that pelvic floor. And it's also going to be phenomenal for a number of other functions. I mean, has anyone been able to do this? Yeah, Star Trekky, okay? Everybody remembers Spock. But now can you do this? Now can you go back and forth? I know, that's talent. This means I was a lonely teenager watching TV a long time, okay? But the only reason you get good at something like that is by practice. So the same thing, if you get good at practicing that pelvic floor, you get good at all the functions. This is how you take care and find out if the pelvis is unstable. It's a trochanter support. Figure this thing, when you look at it, I've developed, I've told you all the problems to build this up. It's so simple to fix, so simple. You put a trochanter support on it. See, there's no muscle that crosses the posterior aspect. So all you got to do is approximate that pelvis and utilize it. Within about 3 to 4 weeks on standard, you can throw the trochanter support away. It's great. And what you do is you find it by approximating the hips. If that feels better or worse, it means it's unstable. You just put this little trochanter support that costs around $10. We usually give them away. Or you can sit like a cowgirl on the right, because when you bring your legs out to the side, you're actually using the hips to approximate the pelvis, and it's a lot more comfortable. That just is a clue that the pelvis is unstable. But remember, this is a perfect joint. It never becomes unstable unless there's a trauma. So birth in an American hospital, a fall on the pelvis, something is going to cause it to be unstable. but you've got to get it restabilized. Muscles, you can't look at muscles as the problem. So many people are saying, yeah, you know, when you're sitting, you're shortening that muscle. It's a tight hip flexor. And then you go to straighten it up. And I mean, you can get people to feel better by massaging or stretching or working the psoas. How about you change the nerves that supply it? Would that make more sense? Because muscles do not spasm on their own. They increase in tone under nerve pressure. Okay, and they're not going to be some kind of weird, there's gentle stretch for this for people that sit a lot, but remember, the psoas is commonly ridiculed for being too tight, and you go through and relax it and tightens up and relaxes and tightens up. It's because it crosses unstable joints. You got to look at the cause. And here you go. When you're looking at this, and I've got bad hips. Now this was a 66-year-old male, couldn't walk upstairs, and we got his before on one side, after on the other. It's tough to see, like over here the after and over here before. There's slight changes. There's slight changes in the distance between the femur head and the acetabulum. Slight changes. So why did he get so much pain relief? Why was he able to walk upstairs? Because we're not just looking at the hip as the problem. Let's see what the survey says. Do you think he had a problem with the second lumbar? Yeah, you can see it. You can see it over here on this picture right there. Okay? So he had compromised nerve supply. What do you think his knees were like? Good or poor? Poor. Feet? Poor. Messed up. Yeah, also problem with the neck. So his gait was off. The pelvis was off. The SI joint, it's hard to see it here, but the SI joint was also white on the x-ray, which means inflammation. So what you do before you get a hip operation, you clean the blood. Did we get him on juicing and blending so that his blood was clean and healthy so it now can filter through and fill up that synovial membrane with synovial fluid? Okay, I mean, it just makes sense. You fix all the structures around it. And then you go in, if the level of pain and discomfort is so great that the risk of surgery, okay, for a 10-year-long thing, so you're planning on not living more than 10 to 15 years, or you're just going to keeping them done, okay, then it's appropriate, because surgery is sometimes needed. A 72-year-old gal, and again, you'll see before hip up here, after hip over here. There's some slight changes. We're seeing a little bit increase in the space. We're seeing a little bit, but why did she have so much pain relief? Because we fixed the gait, we fixed the hip, we stabilized the pelvis, we restored the nerve supply, you restore the blood supply. Doesn't that make sense? Because they don't wear out because of use. They wear out because of a toxic, deficient lifestyle, poor biomechanics, altered nerve supply, or blood supply. The three factors that are totally and completely missed, okay, by 90% of the people. The doctor from Connecticut said that this was just a block of wood. No, there's a therapeutic medical device. So I hit him in the forehead with it. Doesn't it feel like a therapeutic medical device? Okay, all it is a 4x4. But I got to tell you, what's neat is long-term compromised back or pelvis. And what we're seeing now is upper motor neuron lesions, and this is damage to the brain through multiple vaccines. Have you ever seen a teenager walk like this on his toes? Yeah, that's typically going to be upper motor neuron lesions or some type of problem with the brain. All of these kids, adults, all of this, they have problems with the calf. And if the calf isn't working right, if you don't have that normal gait, then you're going to have an altered gait. What's that going to affect? The hip. So this is one of the most commonly used devices that we give. And I started cutting them up, just a simple block of wood. So if you're a chiropractor, a doctor, or a physical therapist out there that are utilizing these things, steal my idea. It works. Because I had a couple of people saying, because I said, look, go out and get a brick. Honey, I'm not going to get a brick. Okay, should I go out and get you a block of wood? That would be so nice. Okay, so I started to get these, and I printed my name on them. I mean, I got them from Home Depot. Seriously, just get this. And if people have it, they're going to use it. And then I can yell at them if they're not using it. Okay, because honestly, I mean, this high-heeled shoe is completely improper biomechanics. If I tell my wife that she can't wear high heels, she's only like, 2 foot nothing. No, she's actually 4'11", but she wants me to call her 5 foot. Okay, so if she can't wear high heels, she's in deep trouble. Okay, how many girls like to wear high heels? Everybody. Okay, well, the legs look longer, the butt sticks up, the guys dig it. Okay, so this one here, if you're going to wear high heels, you just got to stretch the calf, and you're going to correct the biomechanics. Now, leg weight exercise, because one of the things that we're going to do, and you can see this block here, this model is standing on using her foot, and she has a 10-pound weight opening up that joint. This is similar to the knee exercise. It's similar to the weight exercise we were talking about last week with the shoulder. There's a 10-pound weight, and what it's doing, because remember, how does that joint get synovial fluid in there? When you walk, you stress, okay, that it creates a negative pressure as the leg swings in the air. What if we were to create a massive negative pressure, having that joint open up, creating a huge negative pressure in that hip joint, and that's going to allow synovial fluid to rush in there. And do this for about 5 to 10 minutes. It's going to create a great compressive load on the stabilization foot, but make sure that when you're doing this, the hip is stabilized. So many people with a bad hip are going to be bending like this. Okay, like, those bird things that were, yeah, this is not moving the hip. Okay, so make sure that the pelvis is stabilized. And that actually is my wife. I said, dear, come here, I need this picture for this thing. So, she did good. And she's actually doing it correctly. But start off with 1 to 2 minutes, 3 to 5 minutes is great. And now, why would we want to use heat on the hip before and after an exercise like this? Increase the circulation, exactly. You don't want to use ice on a hip because this is an extremity. Because what's ice going to do? Ice is going to shrink the swelling and make it feel better, but we want synovial fluid production. What's synovial fluid production? A superfiltrated blood. What's heat going to do? It's going to rush blood to the area. So it's a radically different approach to rush blood to the area, cause inflammation. What this is doing is opening that joint up. It's causing inflammation. Inflammation is how the body heals. This is how you regenerate tissue. No. It's not, oh my God. It's, wow! That makes so much sense. How come no one ever explained it this way? So sitting, we have to understand that we're not designed to sit. When you're sitting on a ball chair is amazing. We use these white foam pieces to increase the curve of the back. And where it goes, the bottom of the elbow is where the bottom of these foam pieces go. And that's going to increase the curve or increase the lordosis. Again, thereby restoring the nerve supply to the hip. So it turns sitting into therapy. But it's back there only for 20 minutes. And then you take it out for 10 minutes, 20 minutes, 10 minutes, 20 minutes, 10 minutes. So you get this pumping action so that the discs aren't negatively affected. This is insane. Okay, never do this exercise laying on your back with your legs up. If you want to have a sick time because when you're laying in this position, it feels amazing. Okay, however, the discs in the low back are wedge shaped where they're open up at the front and narrow at the back. When you lay in this fashion, you're rocking that pelvis backwards, and instead of a normal healthy wedge shape where the wedge is at the front aspect or anterior aspect of the disc, when you lay like this, you change the shape of the disc. So when you try and get up after a while, you're bent in this position. Okay, this is an incorrect biomechanical position. Don't sit like that, because this is, when we're talking to new patients, I'll say, I'm going to tell you certain things that you can do, certain things that you can't do. And if they're in for long-term back problems, pelvis issues, autonomic dysfunction, blood pressure issues, all of that, I know that it's a dysfunction of the lumbar or nervous system. And I'll say, well, for one thing, you can't lay on your back with your knees bent. And they'll look at me, how'd you know? Well, You got a horrible gait, you can't walk, you got an autonomic dysfunction, you know, you got one poop a day, you know, you can't sleep right, you got chronic fatigue, I know your pelvis is messed up. How do you know? I can read a map. Don't do that. Okay, this Cobra exercise, but when you're doing this, and this is a great push-up exercise, not for the hip, but for the nerves that supply the hip. Okay, make sure that you get x-rays, but when you do this push-up, you don't want the pelvis to move. Act like where your belt is bolted down to the ground, so you're just isolating that lumbar. Have your chiropractor, you know, qualified physical therapist, or brilliant medical doctor show you. Yeah, he's really good. I like him. Other exercises. I mean, all of these things are designed not to specifically move the hip. The hip exercise is typically just that distraction. This is to support the other structures around it. But you can't do these exercises if you have compromised nerve supply. This gal, this is one of the coolest gals ever. She comes down from San Francisco, and she came in, she's a belly dancer. And you can see before is right here, afters, that's her full back. You can see that there's a lateral deviation. What supplies the hip joint? It's L2. If you're familiar with anatomy and x-rays, you can see L2 is the worst bend in her spine. She also, 50% of low back issues are coming from the neck. You'll see that the top one shows a beautiful curve in the neck. That's her after one. The before one shows a straightening of the curve in the neck. Yeah, that's right. Hip issues are secondary to low back nerve compromised or altered mechanics. Yes, that's right. 50% of low back issues are coming from the neck. This is why work comp is work psychotic. Okay, if they have, think of this, they only work on the area of trauma. If you've hurt a knee, is that going to affect the shoulder? Of course. You got to look at the whole structure. You can't think, oh, hurt foot, will work on the foot. No, you got to look at the entire biomechanics. So I'm asking this gal, and I said, you know what, can I take a picture of you? She says, no, take a picture like this. She stands up, puts her leg up in the air, and I'm going, wow. And you were up for hip surgery. Okay. I got to show people this. And then she says, that's not all. And she does the splits right there. Like, wow, that's cool. So it's just, I mean, when you work with people, people are really cool. Yeah, so she's doing good. The things not to do, and this is not to do. No working on the hip until you correct the foot and calf biomechanics. It's never going to work. You can do the hip exercises at the same time you're doing the foot and calf exercises, but you're not going to have altered mechanics here unless you fix the running gear. Okay, you're not going to fix it. No hip rehab without fixing the lumbar or pelvic correction. Why? Because the hip joint doesn't operate in an isolated environment. You got to find out why it's messed up. You must correct the pelvic instability before the hip pain rehab. Absolutely. Doesn't that make sense? Because you're not going to have altered foot mechanics and expect to fix the hip. You're not going to have altered nerve supply and expect to fix the hip. No ice therapy. You're not going to decrease blood flow and hope to God the synovial fluid is produced. No, you're going to take an appropriate action by increasing blood pressure there. And you're going to eliminate the prescription drugs that make the blood toxic or destroy the physiologic response, like building cartilage. Okay, yeah, doctors, please listen to this. Okay, the solutions, you need to get a full x-ray. And I'm not talking of the hip. You need to look at the entire spine, cervical, thoracic, lumbar, pelvis. Once the pelvis and lumbar is being restored, start the hip exercises, get the foot and calf corrected, get proper supplements and nutrition. That's right. You need healthy blood supply. You need healthy blood. You need appropriate nutrition. Does that make sense? Eliminate prescription drugs that are toxic to tissue regeneration. As weird as this sounds, can you imagine a doctor saying, well, gee, but you can't get the effective pain relief unless you take the Advil or ibuprofen or the non-steroidal anti-inflammatories? Well, how about this? Green vegetable juice, natural anti-inflammatory. Turmeric, phenomenal and good for tissue repair. Blueberries, delicious and anti-inflammatory. Papaya, cruciferous vegetables. This looks really good, doesn't it? And why is it anti-inflammatory? Think of this. Inflammation is how the body heals. If I go in and scratch myself, I'm creating an inflammatory process. That's how the body regenerates tissue. The way we're going to regenerate hips is by causing an inflammatory response. That's the only way hips regenerate. This is essential. So what anti-inflammatories do that are natural from a plant-based is inflammation creates these little things called free radicals. That's the oxidative process. If you handle those free radical formation, you build tissue healthy. It means the inflammation process is doing what it's supposed to do to regenerate tissue. If you're insane, you're going to take a non-steroidal anti-inflammatory that stops the healing process. If you're smart, you're going to take a plant product that takes care of the free radicals, allowing the body to regenerate the tissue. Does that make sense? Why this isn't prescribed is because of the ignorance of our medical system. Ignorance of the educational process. I don't want it to be money. You might be right, but I'm hoping not. Okay, polyunsaturated fats are toxic to the system. Okay, flax oil, unless it's fresh ground, it's okay, but these polyunsaturated fats cause the blood cells to clump together. We need healthy blood for healthy joints. Red blood cells, like this bottom left picture, they're supposed to be separate and beautiful and holding oxygen. If you have low stomach acid, yes, that means if you're taking a proton pump inhibitor, antacids, Tums, Rolaids, that's low stomach acid. Those blood cells clump together into this rouleau coin formation. You remember, we're trying to build synovial fluid. If you have toxic blood, it can't get through that synovial membrane. The joint desiccates or dries up. It doesn't work right. Does it make sense that to regenerate a hip, you got to have healthy blood? Yes or yes? Yeah. Optimize the gut flora, you got to do it. We've done this. It seems weird that your gut flora has to be healthy to reverse cancer, has to be healthy to regenerate joints, has to be healthy to help your brain function, has to be healthy to reverse depression and anxiety. So is the gut flora important? Yeah. Absolutely. And when we look at the 5 keys of health, nerve supply, is that important for hip regeneration? It's vital, vital. Regular exercise? Absolutely. I'm sorry if you read the journal article. Oh, don't use it. No, you use that hip joint to wear out, just wear and tear. That's why we're getting so many young people in here. They're just using their hips. They shouldn't be using it. They should be sitting down. Yeah, okay. See how that works for you. Okay, proper nutrition. Honest to God, you read this and you go, are you really that stupid? Okay, sufficient rest, because that's when your body regenerates. Okay, you got the parasympathetic altered because the sacrum's messed up. Do they have good sleep or poor sleep? Poor sleep, always, 100% of the time. I'd invite you on the cruise, but it's all booked up. Okay, now this is a lesson to me, because I like planning a weekend trip on like Thursday. Okay, I didn't know that people book cruises 6 months to a year in advance. We're like 4 months away and there's not a space left on the ship. Okay, so I know it's fun, except there's a lot of people pissed. I reserved like 30 cabins and they're gone. Okay, so next year I don't think we're going to be doing a cruise. We're going to be focusing in on doctor education, so I'll be doing a whole bunch of weekend seminars around, okay, to teach doctors on how to do this. In 2019, we're going to do another cruise in the Caribbean, which will be really fun. And please utilize our site. This site is so amazing. When you see the articles, Michael, what's the title of that new series?
Selling Sickness.
Selling Sickness.
Wow, what a name.
I know. The title alone, it's like, oh, I got to read this one. And it's brilliant. I mean, brilliant. The disease database is incredible. You can get all the handouts, everything. It's amazing. Any questions?
Any questions?
Yes, sir.
You brought up about the feet it's happening because of the hips. But then you says work on the feet and the calves first before you work on the hips.
No, at the same time. You got to fix everything at one time. It's not like you fix this thing, but know that compromised blood supply, nerve supply, and altered mechanics are the source of the hip injury. Okay, and since those nerves supply the knees, the calves, the tracking of the patella or the kneecap, the biomechanics of the foot, you're going to see hip pain maybe present at the hip first because it's a big joint, but you're going to see all these secondary symptoms that are commonly missed. And you can't fix the hip unless you fix the biomechanics. So you got to fix everything. But you cannot fix the hip unless you fix the three missed causes: the nerve supply to the hip and the nerve supply to the foot, calf and foot, and then the blood supply to the entire body, and the mechanics of the pelvis, the mechanics of the knee, and the mechanics of the foot. All of those, the mechanical, neurologic, and vascular components have to be checked from here down in order to help the hip. Isn't that cool? I know. It's like, God, it makes so much sense. Yes, sir.
Yeah, people who had the hip replacements, do they still have the problems
Oh, yeah.
until the next surgery?
They're still going to have the unstable pelvis. That's why 100% of the time we give them trochanter support, they feel better. 100% of the time they're going to have altered mechanics of the knee or foot, or they're going to, because they're missing the cause. They're missing the cause. Hips don't wear out. That person had to have toxic blood, altered nerve supply to the pelvis. They got to have altered mechanics. Hips don't wear out. It's not wear and tear.
So what do they do?
If they've had their hip replaced, you got to fix all the supporting structures so that fake hip is under less strain, and maybe we can make it last a little bit longer. It's just, I mean, because it's a bummer. Except that hip will wear out because you know the pelvis is going to be unstable, you know the calf is messed up, you know the blood is not healthy. You got to fix all the problems that caused the bad hip in the first place. So even if you've had a total hip replacement, you got to fix all the other things, and then hopefully.
The way he fixes it is takes Advil.
Which is a non-steroidal anti-inflammatory, destroying the joint cartilage and the proteoglycan production, so his knees are bad, pelvis is bad, and if it's the hip, how many bowel movements a day does he have? 1. His sympathetic dominant state is high. Is he also taking blood pressure and cholesterol drugs? Yes, sir.
Dr. John, what's the most significant exercise you can do to stimulate blood flow to alleviate a necrosis on the bone, on the femur bone?
The most frustrating thing that you just said is bilateral hip necrosis. We got a patient that came from San Diego who couldn't walk from the car to the door, which is about 30 feet, and now she's up to 1.5 miles, and she had bilateral femoral, it's called avascular necrosis, which is a complete lie because it's not avascular, okay? And necrosis means necrotic, like breaking down totally, and the hips can regenerate, same thing. Okay, so what you do, you've got to clean the blood with juicing and blending. Okay, you've got to get the digestion healthy. So that's going to be 3 bowel movements a day, possibly a colonic. You got to stabilize the pelvis. You got to do the leg swinging exercise. So you're going to cause a localized inflammatory response. Do you think that you need to work on the calf and the foot?
Probably first.
All in junction. Yeah, I mean, it's like shotgun, man. You hit everything all at once as much as you can, and the body will start to heal. Yeah, always. It has to. It has to. It's like scratching yourself and say, okay, try not to heal it. Health is your natural state. If you cause a localized inflammatory response, the body's just going to get better and stronger. Isn't that cool? I know. We're actually a really good design. Yes, ma'am.
Large dogs have hip dysplasia. Is that from running too much?
No, it's actually from the inbreeding. Okay, the inbreeding. All dogs came from wolves. And so what's happening is we're seeing these specific breeds, they're getting less and less and less diversity. So like Great Danes, one of my really good friends, she just moved down to Costa Rica, she had a number of Great Danes and really, really bad hips, and it just has to, because they're inbreeding so much to maintain the integrity of that breed that they're losing the diversity and they're ending up with certain anomalies. It's like you're not going to see hip dysplasia or hip problems in a wolf because they have enough genetic diversity, and that's kind of what all dogs are. Yes, sir.
German Shepherds generally have...
Same thing, same thing. You know, you're going to see certain breeds are going to have certain dysfunctions, and that's because that breed is off. The tough part is it's not a breed system with our human race. Okay, when you have young, middle-aged, healthy, well, middle-aged, I mean 30 to 40 years old, Jesus. You know, we're supposed to go to 120. I'm not even halfway. So I'm on the other half of the middle-aged, okay? I'm like the first third, okay? So you look at this, and there's no way our species should be deteriorating. And then it's worse when you start to see the patient after patient after patient that has one destroyed hip and one good hip. It's not age or wear out or wear and tear. That's foolishness, okay? It's compromised blood supply, nerve supply, or mechanics. Yes, sir.
We need to work on the calf with the block, but how do we work on the foot?
Oh, walking barefoot. The foot's actually a good design. And so you don't need the orthotics unless you've had toes removed because of frostbite. I know in your neck of the woods, it might be frostbite, but I've seen your toes, they're fine. You know, you don't need an orthotic, you don't need all of the supports. You need to have healthy foot motion. You will need an orthotic if you're congenital anomaly, there's something funky in there, you've had toes cut off from frostbite, you know, or some type of... I actually had a guy that shot himself in the foot with a .45. Surprisingly, because that's a big bullet, it missed all the bones. And I know, thank you God. And he didn't do it on purpose, but you know, it's, you know, trying to get out of mowing the lawn. But you know, he didn't even need an orthotic. Okay, we just had to rework the tissue and he was fine. Yeah, so walking barefoot in a hard, like the hard sand next to the water or an uneven surface like grass, start picking up stuff with your toes, you know, pinching your girlfriend or, you know, boyfriend, you know. Yeah, just having fun. Yes, ma'am.
I have a question about the belt that is, like I saw on the video,
Yep.
to stabilize the hips, right?
Yep, the trochanter support.
Like if you break like a bone and then you put a cast, that doesn't gonna weaken the mass if you keep wearing that too much? Like,
Oh, yeah, perfect. Perfect. That's the best one. Okay, now this is why you don't like back brace, a neck brace, an arm brace. All of those things are going to negatively affect the joint. They are. That's why you use them for a temporary basis. What's unusual in the trochanter support is there's no muscle that crosses the back half of it, so you're not going to atrophy any muscles. And in fact, you're approximating this ligamentous structure that's part synovial, part fibrous, and you're approximating it. You're taking the stress off of it so that ligament can shorten up. So it's kind of like if you have an open wound, in order to heal it, you approximate it. Okay, you know, with stitches, glue, or whatever. So this same thing, you approximate, you take pressure off of it and then use it. That's why that belt only works when you're standing or walking. And then within about 3 to 4 weeks on average, you throw the belt away. Joint gets close, heals up, because it's supposed to be normal. Okay, that's its natural state. Yeah, so it's only temporary while you're stabilizing or correcting the problem. Because remember, it's a perfect joint. It never wears out on human beings. I get people near 100 years old that have perfect pelvises. It doesn't wear out. Perfect hips. Yeah, except, you know, of course, they're at stick class, they're at yoga class, they're working the heck out of their hips because they know that moving the joint is healthier. So you're approximating it once that hip is restored to its normal position by bringing it together, then it's perfect and normal the way.
how long should the person wear that for the day?
As much as they possibly can while they're standing or walking. It doesn't do any harm if you wear it sitting, but there is a nerve that goes down the side of the leg called lateral femoral cutaneous nerve. That means it's on the side, comes out of the lumbar area and supplies the skin on the side. And if that's compromised, you can have some numb areas of skin. which on the off chance it's also called meralgia paresthetica. The only reason I know that is because that was a board entrance exam, and I didn't get that one right, but I described the branch off of the lumbar spine, exactly what it did. I said it's lateral cutaneous nerve syndrome, and they said, what is it called? I don't know, lateral femoral cutaneous compression. They said, well, we'll pass because you understood everything. And it's, Jesus. Yes, ma'am.
Let's say someone took long-term 10 years, those NSAIDs. How quickly, once a person pulls themselves off of it, that the joint damage is restored to normal as far as the cartilage?
It totally depends on how much damage was done. If they had not just 10 years of non-steroidal anti-inflammatory use, but let's say they had a sedentary lifestyle, they also had flattening of the feet, they had high physical, chemical, and emotional stress, they were taking poor sleep patterns. I mean, you're talking just a mess. Could take a couple of years, okay? 2 to 5 years tops. But typically you're gonna see changes in 30 adjustments, and that's could be anywhere between 2.5 weeks to 90 days. Yeah, so people, I mean, it's like how, if you actually break a bone, 4 to 6 weeks later, thing's brand new. Body's pretty cool. Next week, it's 4th of July, and we're not gonna be having a Tuesday, True Health Tuesday. I'm sorry, it's fireworks. And in fact, next month, we're gonna actually have a talk on what to do to get your kids a medical exemption. Okay, what the rules and laws are in that, because otherwise in this country, it's forced medical procedures without your informed consent. Okay, and that would never have flown in the 60s, but for some reason the fluoride in the water must be working. Okay, and then we're also gonna be talking about biohacking, and I'm probably gonna do a knee and foot health video too.